I'm pleased to be speaking with those of you who are interested in or working in occupational health. In this video, I'm going to share 5 important steps that your practice can take to help employers in your community substantially reduce costs associated with work-related injuries year over year with a system that has a proven track record. These 5 steps are the backbone of DSI Work Solutions' job function matching system. The good news for you is that this system will generate a significant revenue stream for your practice, as well as create long-lasting relationships with the employers in your community. So let's look at those 5 important steps. Step 1 is analyzing the company's workers' comp data. That data includes claims information such as types of injuries, costs, days off work, and also employer data such as hazards, controls, injury prevention, and return to work processes. With each company, you will want to establish goals and what will be tracked so that you know how you are determining your progress. Step 2 is conducting a job analysis focused on identifying essential functions and the physical demands that correspond to those essential functions. It also includes looking for ergonomic opportunities that can be considered for improvements. This interaction takes place with employees and other employer stakeholders and is a very important first step to the development of a foundation of trust. Step 3 is a well-written document that is developed from the first 2 steps that succinctly describes what the job analysis findings were. This document should be written so that all employer stakeholders, such as supervisors, employees, safety and HR professionals, and others, can understand it, as well as you, the important medical providers and other health providers, so that you can all understand what the workers need to be able to do and communicate effectively on important information related to work activities. I'm going to share steps 4 and 5 with you, but first I want to share some other important information. First, you probably wonder who I am. My name is Ginnie Halling, and I am the President and CEO of DSI Work Solutions. I've done this type of work for most of my career, for 30 years and climbing, and I have worked with many different businesses and industries throughout the United States. I've had the privilege of working in hospital systems, working with occupational medicine practices, working with companies directly, such as in warehousing, manufacturing, assembly, and in tactical workforces, such as with fire and police. Many of these companies reported reaping benefit, including return on investment, such as financial improvements, and value of investment in terms of the loyalty that it created with their employees and the positive morale that was generated through the interactions with the job function matching system for both employees and management staff. Loyalty is created when workers experience outcomes, such as those experienced by Weather Shield, who experienced a 50% reduction in workers' comp costs over the first 2 years, and reported on the improvement in morale with their supervisors and employees alike. Then there's Sanford Health, whose pilot study was able to show an 81% reduction in restricted days, and also they reported on the improvement in morale with both employees and supervisors. In today's important emphasis on mental health, this trust that is the base of the workers' comp system being handled through job function matching is as important as is the financial gains that can be achieved as well. Now let's get back to the steps. In step 4, after the analysis is completed and the document has been developed, the stage is now set for the design of a function-based physical demands test that can be used for hiring, such as post-offer of employment testing, and can also be used for return to work, both in work and non-work related situations. Can also be used in things such as annual injury prevention programs to promote maintaining worker safety, And when it's necessary, it can even be used in disability management. Testing is an important way to communicate a worker's abilities relative to the job that the employee is expected to perform. Now on to step 5, which is matching. This is the final critical step, looking at the workforce and matching them to the work activities that they're doing. Match them when they're hired. Match education that is going to reduce injuries and be meaningful to them. Match them when injuries and illnesses occur. Match them when fit-for-duty questions arise and need to be answered. So now you know 5 important steps that your practice can take to build long-lasting relationships with your employers, gaining results for them, and generating a new revenue stream for you. If you don't provide these services, chances are someone who is outside of your community will. Most employers do prefer to work with local providers, and you can be that local provider. Now, you may be able to do these steps on your own, but DSI will work with you if you choose to bring us along, consulting with you on the side as you implement this system and begin implementation. We will meet you where you are. Some of you need more support, some of you less. We will work with you, guide you, support you, and make sure that you get just what you need for your practice to be successful. If you can see the potential benefit of offering these services to your community of employers, let us help you explore. We can teach you what you need to know, we can partner with you at the level that you are interested in, and we can help you deliver the best services for the best outcomes. If you are ready to explore further, look at the calendar below and schedule a time to meet with us. Let's talk.